great.
Yeah. Whatever helps the community. I mean, you hit on every major point. Yes, historically there have been some issues, but we have to move forward. And when you start thinking about, unfortunately, we are in the midst of a global crisis. When you start thinking about, the speed or the expediency in which it was developed, we can answer that. And it was done safely. And there's some inherent issues, but those issues are with any vaccine. Other than that, it's as safe as any other vaccine out there. And that's just something you really have to drive home. And sometimes it just takes the conversation with the patients and their families.
Folks, we have finally gotten live on Facebook. It is booting up right now. I apologize for the technical issues. As you'll clearly be able to see, I will not be getting a career in IT after this, so we can scrub that off the board. I do want to thank everybody on the panel for their patience, and everybody waiting to watch. Thank you so much for coming out today virtually to be able to talk about the COVID-19 vaccine. We've got a lot of great questions that were submitted on GastonSaves.com by residents all over Gaston County, and we'll be going through those today. But first, I want to introduce our panel. We've got a lot of fantastic folks here that have volunteered their time to be able to talk today. Let's start with our Public Health Director of Gaston County, Steve Eaton, and then we've also got Major Chris Ross, who's with GEMS. Both of them here are Gaston County employees. And then we've got a number of different physicians, and we've got the Chief Medical Officer for Caremont Health, Dr. Todd Davis here. And Todd, I wonder if you'd be able to introduce some of the folks that you've got with you today, the different physicians that you've got on board.
Sure. Really a great group of folks that are extremely dedicated to this community and the patients they serve here. So I'm going through the screen down, Dr. David Reinhardt, who has been a family practitioner here for decades. And I believe he's the president of the North Carolina Family Practice Association this year. Dr. Jamie Villarreal, who is a private practitioner, an extraordinary doc. And we were just talking before, and Dr. Crystal Bowe was remarking on how his patients and the families that work with him just love him. Dr. Crystal Bowe, who holds the title as one of our quality leads in our primary care service line. She's been in our community for years. She's multilingual and actually is working a lot with our Latinx community, trying to break down barriers. And then Dr. Chris Harley, who's a general surgeon, who also actually, he's a trauma general surgeon and critical care physician. And he's been in our community for about 6 or 7 years. He's a really wonderful guy and has been actively trying to educate our community and our patients too. So thanks for allowing me to introduce them.
Absolutely. Thank you, Dr. Davis. And my name's Adam Gobb. I'm the communications manager for Gaston County. I'll be facilitating the conversation today. I want to start off with a question for Dr. Reinhardt. And we've gotten a number of questions about the COVID vaccine. And one of the key questions that we're getting, sir, is that people are wanting to know, what are the complications that people are seeing from the vaccine, and are there any individuals that shouldn't get that vaccine?
Yeah, thank you, Adam. This is a remarkably safe vaccine. It really is. It's been well tested. I know there's this concern about how quickly it's come out and so forth, but it really has been very nicely tested. And now we have like 20 million Americans who've had it now. And we've been keeping track, of course, of any complications that are coming out of that. So it's really been quite safe. There are these like 1 out of 100,000 might get a more severe and what we call anaphylactic reaction. You probably heard of that, which is sort of an allergic reaction that might require like an epinephrine shot and that sort of thing. There's been a few people through that, millions of people who've been hospitalized overnight, but no one has died that I've heard of from this shot. So anyway, it's a very, very safe shot. A lot of people getting a sore arm, getting a little headache, fever, so forth, a day or two afterwards, but a remarkably safe vaccine. In terms of who shouldn't get it, there's very few people who should not get it. Well, of course, we're in our grouping, we're 65 and above and healthcare providers right now. So in that group, most everybody is really eligible to get that. If you have had a reaction to the ingredients in the shot, which is very rare sort of thing, it's sort of there really isn't much. There's no problems with chickens and strawberries and eggs and so forth. No reaction there, even if you're allergic to those sort of things, not a problem. If you have had very severe reactions to other injections, we watch you more carefully. We want to know that and watch you a little bit longer after the shot, but still, most everybody, even with those type of reactions in the past from like a shot from penicillin or something like that, even those people are really eligible for this vaccine with a little extra observation. So there's a couple other rare situations that shouldn't get it, like someone who's had the antibody treatment. They're supposed to wait 90 days after that. There's a couple of things like that, but basically almost everybody. If you have a question, ask your doctor if you have one, I hope, or the people at the vaccine places are usually aware of who might be ineligible, and there's a list that you go through questions before you get it. So that's sort of an overview.
Excellent. Thank you, Dr. Reinhardt. There were a couple other questions that really delved into kind of safety of the vaccine. Sherry had asked if there's steroids in the Moderna or Pfizer vaccines as she's got allergies to steroids. And Angela asks, she says, I have allergies where I need a steroid shot to bring the swelling down. Is the vaccine going to be safe for me? And I wonder if Dr. Harley would be willing to take that question.
Sure. Just based on the multiple journal articles that I've researched since COVID hit, the only contraindication that I've noted is an allergy to polyethylene glycol or polysorbate. And these are commonly found in stool softeners or stool or cathartic-like compounds such as Miralax, Colace, and Golightly. If you have allergies to food, insect bites, venoms, those are not contraindications to taking the vaccine. And if you have, as Dr. Reinhardt stated, if you have allergies to previous vaccines or documentation thereof, then about a 15 to 30-minute observation after taking this vaccine should suffice and has, it has been the routine. That still is not a contraindication, but I've not seen anything else. Now, to those people who may have hypersensitivities that require steroid injections or epinephrine shots, I would say the safest thing is, to have that available, take that with you, in the event of an unfortunate circumstance. But there's been no documentation to show that that would be required for this vaccine.
Good deal. Thank you, Dr. Harley. I'm going to ask this next question for Dr. Davis. This is one that comes from Joshua Miller, who's watching the Facebook live stream. And he asks, can the county or Caramont go directly to the vaccine manufacturers to purchase vaccine without having to go through the federal government or the state? So I'm going to put that to Dr. Davis.
I'm going to let Mr. Eaton answer that question. I think he's really coordinating the county efforts and understands the logistics. So I think he would best be able to answer that.
Yeah,
perfect.
Great. Yeah, thank you for that opportunity. So to the question about receiving vaccines, so the allocation first comes to two states from the federal government. The federal government determines how much vaccine each state is going to get. Once that state receives their allocation amount, and that's through the North Carolina Department of Health and Human Services, they then turn around and distribute that vaccine to the approved vaccine providers within the community. So initially that was just Caramont, and that was just public health or the health department. We've had more recent providers of the vaccine come on board, which is great. We'd love to be able to have more providers getting the vaccine, spreading the vaccine. And I see Dr. Davis nodding his head, because we know the more we can spread this in the community and make it more efficient from an equity perspective, as well as from just a community coverage perspective, people would have more access. But I can attest that Caramon and myself are constantly in communication with DHHS saying, give us more, we want more, we can do more. But unfortunately, the state is receiving such a limited supply. On a week-to-week basis, the state gets about 1% of the population, vaccine for the population, 1%. And then that is then divvied up between 100 counties and then divvied up between all the individual providers. Certainly, we hope as we move forward that more vaccine will come. And but as far as going out and buying it, purchasing it, or somehow leveraging some mechanism to get more, we really do rely on the state's allocation.
Thank you, Steve and Dr. Davis on that. Had a question that was sent in by Holly. I'm going to ask this for Dr. Villarreal. She says that she has Bell's palsy, had Bell's palsy in the past, and she heard that one of the side effects of the vaccine make sure I'm reading this correctly. Basically, the side effects are more severe in people that have had Bell's palsy, is what she's hearing. And so she wanted to hear from one of the physicians about whether that was true and whether she should be concerned about getting the vaccine.
I think that is a rare side effect. There has been some reports of people getting Bell's palsy following the vaccine, but I think it's been very few cases reported. I'm not aware that a patient that's had Bell's palsy would be a contraindication to getting the vaccine. As has been already stated, there's very few reasons or exceptions to not getting the vaccine. So I would encourage a person, even if they've had Bell's palsy in the past, to get the vaccine. I'm not aware that that's a contraindication at all.
Good deal. So this is a question that I'm going to put to Dr. Bowe, and I'm going to see if Steve will maybe jump in on this too. There's a question here from Candace, and she says, she'd like to know, with the numbers continuing to climb, the county, she says the county's doing nothing to bring them down. You've got schools and stores and gatherings still happening as they did in the beginning. First to Dr. Bowe and then to Steve. Are you able to talk a little bit about what we're seeing right now with the numbers kind of across the county, and maybe finally a little bit of good news on that front, I think?
So I was excited to say, and we were talking about this just before we came on the recording, we are finally able to say that hospitalizations are going down some, that we're seeing decreased rates than what we were seeing between Thanksgiving and Christmas. So I think we are really seeing some improvement in the numbers. It is frustrating to see folks who aren't following the social distancing guidelines, who aren't staying home. That's a problem across the country. So it's a frustration, but it's not a Gaston County problem. It is across the country. And all we can do is continue to encourage people to do that. Wear your mask, stay home whenever possible, stay 6 feet apart. And I'm going to remind folks that as we get the vaccine, you got to continue to wear your mask even after the vaccine until we've all gotten that vaccine where we have herd immunity, meaning we have enough percentage of our population that's protected that we can safely say that we're not going to share the virus anymore. We've got to keep our mask on. But we are hopeful that by the fall, we will be resuming some more normal activities. So it's been frustrating, but tell your friends and family, you want them to stay home. You want them to follow these guidelines, and know that as we roll out the vaccine, we're going to be getting us back further, closer to normal. I've been impressed across our community organizations for the way that we've come together and the way that we've been vaccinating folks. You might be surprised to know this, but Gaston County's done an amazing job, particularly in comparison to other counties in the state. And our communication and our partnerships together have really helped us be as successful as we've been.
Yeah, just to piggyback on that. So you're right that the numbers were alarming and continue to be alarming. So coming out of the holidays, Christmas, New Year's, a couple weeks after, we were at the highest point of the surge, both in hospitalizations, daily new cases, percent positive, skyrocketed. We somewhat anticipated that, but it took our community by storm. We still have a very, very high rate of new positives. Our percent positive, and the way we determine that is it's the total number of tests that are positive in relation to the total number tested is right around 15%. So that's 3 times where we want to be. So to Dr. Bo's point, we got to keep our foot on the gas pedal. We have to do what we know works, which is masking and staying socially distanced and washing our hands, which I know ad nauseum we're tired of hearing, but we got to keep doing it. That along with getting vaccinated. I can't express to you enough that your name is on a shot. Everybody has a shot for them, and you will get it when it's your time. And once you receive the vaccine and our community gets that herd immunity level, we're going to be in much better shape to move on. I'm very encouraged by the lines that I see for vaccination, for our phone lines being blown up. To me, that's a very, very positive sign that people want to get vaccinated, and that's what we want to see. As far as partnerships go, I don't think people have a clue how lucky we are in Gaston County to have a hospital like we do, to have the partnerships like we do with the school system, our Contegra, churches, the faith community. It goes on and on and on. And we are all locked in arms, holding hands, getting through this together. We have task force that the county managers put together to create work groups to work on being better culturally and linguistically appropriate in our efforts. It is ongoing. Can we do better? Absolutely. We can always do better. And Dr. Bo and I were speaking about this. This is only going to make us better as a community post-COVID, because there's so many of these efforts that are going to continue regardless of whether it's a pandemic or whether it's reducing our racial and ethnic disparities in Gaston County.
Talking about partnerships, Steve, I'm going to bring in Major Chris Ross with GEMS. One of the things that we've been able to do in doing the clinics that the county's been running each Friday is a partnership between the health department, our Office of Emergency Management and Fire Services, and GEMS, in addition to local police as well, to make all those clinics work. And Major Ross, I'd like to ask you, you're one of the first responders that's actually had the first dose of the vaccine, and you've been part of administering the vaccine. And I wonder if you can talk a little bit about your experience with both.
All right, so actually I got my second shot yesterday and completed the vaccine with Moderna. Very excited to get the shot. My family had, I'd rather say, COVID back in June, early July. And I was very excited when the vaccine came, and as quick as it came, so we could all get vaccinated and prevent any other people from getting coronavirus, because it's a horrible virus to go through if you haven't had it yet. So the partnership we've had with DHHS and health department, fire departments letting us use their fire departments for vaccination clinics for first responders has been awesome. I can say that I gave out a lot of vaccinations to our first responders the few days that I did work there. I know one person came through. I remember her because she was crying and she was so excited to get the vaccine. And that's just something memorable that stuck out during that first round of vaccine administrations that we did there at Gaston Fire Department Station 5.
Thank you, Major. I appreciate you being able to give us some of that, firsthand insight into some of those clinics. And we're glad to hear that you've got that second shot. And that's really exciting news.
Yes.
I'm going to turn a question to Dr. Harley. We got this question in on our Facebook live feed from Carmen, who's watching, and she wants to know, are there dangers in getting the shot for diabetics? I know as we've been doing some of the clinics that there's questions with the Pfizer vaccine that we're asking folks about blood thinners, but I know Carmen's asking about diabetics in particular.
Right. Am I still not muted?
You're good.
Okay, good. Again, I've not seen any data whatsoever to suggest that there's an adverse effect on blood sugars, or that it causes some type of transient change in those who are insulin dependent or even on oral medications. So I don't think it affects any diabetics. Again, the only people that are somewhat excluded when you start talking about allergies and adverse effects, or those who have existing allergies to those compounds I mentioned earlier, polyethylene glycol and polysorbate.
Good deal. I'm going to turn a question over to Dr. Reinhardt. We got a question in from Susan who says, is the COVID vaccine the same as childhood vaccinations? She asks if it's similar to like an annual flu shot.
Well, we don't know how long it's going to last yet. That's an unknown here. So it might end up being something that's done annually, needed annually. It might change year to year. It might last a much longer time. We really just don't know that yet. This hasn't been around long enough. We don't know. That'll come as we go along. But I don't know quite what they mean by like a childhood vaccine. Children will be getting this eventually, but right now they cannot. It's only approved down to age 16 at this point because the testing hasn't been done. But it'll be done, and there'll be children's COVID vaccines coming up, I'm sure, in some months ahead. And it'll be it'll be a regular thing that we're all going to want. This COVID's not going to be going away anytime soon. It's going to be something we're going to have to deal with for many years, hopefully successfully deal with it through vaccination largely and public health measures.
Excellent. Got a question that kind of similar to that, and I'll ask it of Dr. Bowe. Catherine asks, after the 2-shot kind of combo that you get for the COVID-19 vaccine, how long do the antibodies last? Do we have any kind of best guess on that, or any research that tells us how long we kind of have that protection?
At this point, I don't think we have any data that says how long it lasts. We know that if you've had actual COVID, we think that you have antibodies for about 3 months. We are anticipating that you'll have antibodies for at least a year. They're still collecting data on that. And so we know you'll have antibodies longer with the vaccine than you would with the virus. And we think that those antibodies will last at least a year, but it could be longer than that. And so as we know the vaccine works, we're able to spend more time figuring out, well, when will you have to have the next one?
I'm going to put this next question to both Steve and Dr. Davis, and either of you can jump in. Got a question here from Anne, who says, is there a way to find out which vaccine is at which site, or if there's a way to choose which one you get? And then she also asks, is the Johnson & Johnson vaccine going to be one shot, and do we know when that might become available?
So I don't mind speaking first to the types of vaccines available in our drive-through clinics offered through public health, and Dr. Davis, I'll let you speak for Caremon as well as the Johnson & Johnson piece. So much like us not knowing how much vaccine we're going to get from the state, or if we're going to get vaccine from the state sometimes, we also don't know week to week what kind of vaccine we're going to get from the state each week. So we've had one shipment of Moderna, and to this point, we've continued to receive Pfizer. But that's not to say that our next allocation that we receive might be Moderna again. So from what we offer at the clinics, it's what we have readily available to us to be able to take out into the community and vaccinate. And as far as picking and choosing which one you get, obviously for our clinics, it's only what we have on hand. We do not bring to the clinic multiple types of vaccines because we're always very careful so as not to give one and then another to somebody else, because the logistical challenges about the second dose when they come back. It's 3 weeks later for Pfizer, it's 4 weeks later for Moderna. And we know all of this is very confusing to the public. So when somebody comes up and asks, okay, with the last clinic, did you get the Pfizer or the Moderna? And people are going to forget. And so we're just being very sensitive to that. So we offer what we have on hand, I guess, is the simplest way to answer that.
Hi, this is Todd again. So to date, the 8,500 first dose vaccines that Caremon has received all have been Pfizer. I suspect that because we have ultra cold storage and the logistical challenges that surround the Pfizer vaccine, which are the logistical challenge and the storage challenges are more significant with Pfizer than any of the others. The hospitals will continue to receive Pfizer. in the foreseeable future, because again, managing them is so difficult, and we have an infrastructure and in-house pharmacists can help with that. The medical group, Caramont Medical Group, has requested Moderna from the federal government. And our hope is that as soon as we get Moderna, those will be available in the practices. Johnson & Johnson, I understand, is applying for an emergency authorization through the FDA. If that happens, the distribution of those vaccines will go through the federal government. Because there's not storage issues and it's a single dose, my suspicion is the federal government will probably look towards moving those into more under-resourced and more types of rural areas, or areas where they are concerned about getting second vaccine compliance from people. So I think there will be very likely a strategic approach to where the vaccines are going. The foreseeable future, when you're able to choose where to get the vaccine, is not going to happen likely until the rationing stops. I believe we'll be in a rationing situation until the end of summer. Because I believe the federal government is going to be pushing things out. There may be an opportunity at some point, but my suspicion is for the foreseeable months ahead, the demand is going to be more than the inventory allows us to give.
And Adam, if I might, back to the comment about partnerships, I do want to highlight too that for the community, that when Public Health or Contegra has received Pfizer's, that Caramont stores those for us. And takes care of those and ensures that they stay safe for when it's time for us to use them. So again, it's a partnership. Things like that are oftentimes what the community doesn't see because we don't have access to low cold storage. So we're able to receive Pfizer's and use Pfizer's and get them into people's arms in Gaston County because Caramont's able to store those for us. So just wanted to highlight that.
And Steve, I'll follow up with you. There's a question from Stephen who, asks something that Dr. Davis just touched on, but I wanted to kind of follow up a little bit. Stephen's asking, when can we expect widespread distribution? He says, as a younger person, I don't want to get it before someone else who's more vulnerable gets their chance to receive it, but he wants to play his part and gets it, get that vaccine as soon as he's eligible.
Well, kudos to you, Stephen, and great name, by the way. So first off, that's awesome as a younger person that you're ready to roll up your sleeve and get the vaccine. Also, even probably more excited that you're willing to take care of yourself and take care of your neighbor from spreading the virus, but allowing others who are more vulnerable than you are to go first. Adam touched on this earlier, but the first group that went through were those individuals that take care of us. So we wanted to make sure, well, not we, the way the rollout came was that we want to take care of the first responders, the medical community, our doctors, our nurses, those people who take care of us, as well as those folks out in the field who take care of us from a healthcare standpoint. Next is the 65 and older group. We know from all the data and all the unfortunate outcomes that those folks 65 and older are most vulnerable. So taking care of them is certainly important. And in Gaston County, that's about 40,000 people. So it's a large group that we've got to go through, and we're going to get there. It's just going to take time. Certainly with more vaccine, we can do more and serve more, but we've got to move through that population before we can move to the next groups. And the next group would be the essential frontline healthcare workers, or frontline workers, I'm sorry.
So we've got a question in, and I know that we talked a little bit about side effects, but I'll ask the question of Dr. Harley. Leon asks, does the vaccine increase tinnitus?
Increased tinnitus?
Yep.
I don't think so. I've never heard that question. I've never even seen that being posed before, but I don't think so. I'm not certain of that.
And just kind of following up a little bit, I mean, what are some of the common things that we're seeing? I know we've touched on this a little bit, but I just wanted to kind of to wrap around and kind of talk a little bit about what are some of the most common side effects that we're seeing from the vaccine at this point. Dr. Villarreal, would you mind taking that?
Well, I can even comment a little bit on my own personal experience. The first shot, I didn't even know he gave it to me. So then I came back to the office and I kind of wondered, did I actually get it? Because I didn't even feel the needle. So about 8 hours later, my arm hurt a little bit, and so then I knew I'd gotten it. And by the next day, I was fine. Now the second shot, I same thing. About 8 hours later, I had some pain in my arm, very mild. But the next morning, when I woke up, I had neck pain, back pain. I kind of didn't feel too good. I had a headache, and I felt hot, but I never had a temperature. But it was very mild. I was able to work, and had a full day. And by the next morning, I was perfectly fine. And and those are basically the general side effects of the doctors that have gotten it in our office. Is pretty much the same thing. It's been very mild, arm pain and just a little malaise, and that's pretty much it.
I've got a question. I'm going to direct this next one to Dr. Reinhardt. We had a question in from Judy, and she's asking, can you get COVID twice?
Yes, you probably can. It seems to be pretty rare, but it does seem to be happening once in a while. We're not sure, maybe is this a different, if you had a mild case, you didn't quite develop the antibodies and you might have gotten it another time without having fully, sort of made all those antibodies against it. Maybe it's one of these variants that we're hearing about. Maybe those are circulating. We really don't know that much about them yet, I don't think. But it's pretty rare so far. I think the vast majority of people who have gotten it once have not gotten it twice. And I'm kind of encouraged by that. I think you do certainly develop some degree of immunity by having it one time. So you're reasonably protected, at least for some period of time. We don't know. But so yes, but pretty rare, I would say.
I'm going to ask this next question of Dr. Bowe, and this is something that probably hasn't been talked about a lot just because we're still in those first few weeks of the vaccine rollout. But if you're a person that got the vaccine and has had both shots, do you need to keep wearing a mask and social distancing?
Absolutely. So when you're getting the vaccine, we know it's 95% efficacy, which means we do not think that you're going to get COVID. But remember, 95% is not 100%. So there is still a chance that you can get COVID. There are 5% of people who get the vaccine may get COVID. So while you're very protected, you should still continue with that. Also, researchers are looking at, can you transmit COVID while not having COVID after the vaccine? Until we have those answers, we're definitely not going to have people going around without a mask. Finally, we want to keep everybody in mask until we reach that herd immunity. And that's for the reasons we just talked about. We don't want you to potentially, even though it's a very low chance, get COVID. And we also don't want you to potentially spread it when you don't think you have it or when you actually don't have any symptoms at all. I can tell you, since I have had my vaccine, nothing has changed with me wearing my mask, with me staying home, with me social distancing. The one thing that's different is I'm not afraid anymore that I'm going to get this virus and bring it home to my family, to people I love, or to my patients. So keep your mask on to keep yourself safe and to keep your loved ones safe, even after the vaccine, but feel confident after the vaccine, you're not going to have some of these horrible experiences that others have had dealing with COVID.
I really like the personal story that you're kind of sharing there, Dr. Bowe. And I want to go back to Major Ross, paramedic, somebody that's been on kind of the front lines of this. Major, I wonder if you can tell us a little bit about just, the number of calls that you've had to respond to over the last 9 to 10 months, dealing with COVID patients, having to gear up in that full PPE, and maybe some of the relief that you feel being able to get the vaccine now.
Yeah, the vaccine was a huge relief, like I mentioned earlier. Though myself haven't responded to many COVID patients in the role I'm in now, but I know daily we respond to 10 to 20 at least PUIs, and then subsequently come back later as positive. And our crews are out there; they are dealing with that daily, and they do feel the effects. And I think that this is one of the biggest hurdles we had to get to this vaccine and getting that herd immunity that other people have talked about, and hopefully get over the hump, so to speak. And that's it.
Good deal. I appreciate it. Steve, there were a couple different questions, and I've seen a couple pop up on the Facebook Live feed. We have one from Deborah and one from Rachel that were submitted beforehand, and they're both asking, when will teachers be eligible, and what will the health department be doing to work with Gaston County schools to help vaccinate teachers, once we reach that point?
Yeah. Great question. So as I mentioned earlier, we're now in the group of the 65 and older population. So potentially some of those teachers are getting it because of their age bracketing. But then teachers and school personnel, educators, all folks who are working within the school system would fall into that group 3. So we are working with the superintendent and kind of staying in weekly communication with him as far as how vaccinations are going, and then keeping him up to date. But once we get to that phase, I could potentially see us working very closely with the school system, maybe potentially even to do a vaccination clinic for teachers and school personnel. Obviously, much like our frontline healthcare workers, we want to make sure our teachers are taken care of as well. But again, it's all dependent on vaccine.
This may go back to Steve, or maybe Dr. Davis can weigh in on this. Obviously, with a lot of conversation in the news, the past few days about kind of how thin the supply of vaccine is right now, and how we're trying to stretch to use every last dose that we can get our hands on. Are those second doses secure?
Yes, second doses are secure. Just as of yesterday, we received reassurance again from Secretary Mandy Cohen that as first doses arrive to the states, as first doses go out to counties after they arrive to the state then carves out the second doses to ensure that whether it's 3 weeks or 4 weeks later, depending on whether which type of vaccine you receive, that there would be adequate second doses.
So there was a question, and I think Dr. Reinhardt touched on it, and I can either have him or any of the other physicians that want to jump in on this. But do we know at this point, are we seeing any of those variants here in Gaston County that have popped up, those that we're seeing in South Africa and England, the more potentially easily spreadable variants of COVID?
I don't know a whole lot about the variant. There's Mecklenburg County has had a positive, one of the variants. I think the UK one maybe. I'm sure it's around. As far as I know, we've not documented that yet, but I think that the thinking is, I believe that it's really going to spread all through the world.
Does that change, and Dr. Buzz is about to jump in, so I'll let her speak here. Does it change how we approach things? Is there any sort of guidance on, dealing with a more easily spreadable variant of COVID?
As it stands right now, it doesn't, and it only confirms what we're doing, and it makes me want to double down and ask other people to double down, because the way the current vaccines were made, there's a small section of the spike protein, so not part of the virus, but on the outside, how it gets into your body, that was put into the vaccine so that your body makes antibodies so it knows to kill the real virus if we ever see it. What we think right now, and they're still proving this because it's new, is that the variants in England and in South Africa, those variants will still be, you'll still be protected against them with the vaccine. They're going to test that out. But that means we want to still get people the vaccine, and we have even more reason to get them the vaccine. The fact that it's spread more easily means it's more reason to wear that mask, more reason to social distance, more reason to stay home. We also want to make sure people are doing these things, because the more these viruses are allowed to spread, the more they can mutate. And the more they can mutate, the more they can become something that may be resistant to the vaccine. So this is an optimal time for us to come together as a community, get vaccinated, and stop it before we get to a point where we've got more problems.
I'll put
That's
this
a great point. This is Dr. Harley. I'm sorry. If I may, could I add on to Dr. Bowe's comments?
Absolutely.
Because, thank you. I think some of those questions come from the expediency of the delivery of the vaccine itself. So I think, something that's key that a lot of people don't quite understand is that SARS-CoV-2, this is the virus that causes the COVID-19 disease and its severe acute respiratory syndrome 2. It's named 2 because this is not the first time we've seen it. The first time was in 2003. And since that time, we've developed all of the preclinical data and benchwork research related to the severe acute respiratory syndrome that comes from these viruses. We've identified the spike protein, to Dr. Bowe's point, as the key component for transmitting this virus, and we've identified the entire genomic sequence, which is inclusive of all 30,000 base pairs. So all of this was completed prior to the first case of what we now know as COVID-19, SARS-CoV-2, being identified on our shores here in America. So you're talking about approximately 17 years of research. So yes, there are variants that are going to come, that are going to arise in the ensuing months. But again, the core of the genomic sequence and our protection lies in our ability to identify the spike protein and approach it that way. And so that's what makes this vaccine not only safe, but allows it to set the foundation for any variants that may arise in the future.
Dr. Villarreal, I know you wanted to jump in on this as well.
Yeah, I just want to reiterate what Dr. Bullock had mentioned, the vaccine should protect us against the variants, but we're not 100% sure, which is another reason why we should wear our masks and social distance and do all those things even after we've received the vaccine. We're just not sure yet, and if you want to protect yourself as much as possible, 100%, those measures must continue even after we've received the vaccine.
One of the questions that we're getting, and I've seen a lot in kind of the Facebook feed of folks that are watching, is asking about some of the current treatments for COVID for people that do get sick. And I know it goes a little bit away from the vaccine question itself, but can one of the physicians on the call talk a little bit about maybe some of the progress that's been made in treating COVID, in the hospital settings, and how that's advanced from where we were, last February or March?
Well, I'll say, I mean, from the outpatient, people need to understand that we just don't have any treatments out here available. The focus should be on prevention. And I'm aware that once you get into the hospital, if you get the virus and you get sick and you wind up in a hospital, there's modalities there that are being given. There's medications and steroids and things. But in the outpatient world, there really isn't anything useful other than we try to continue to stress the importance of social distancing and wearing your mask and all those social things that we've discussed to try to prevent it. That's the most important thing.
Hi, this is Todd. And to reiterate what Dr. Villarreal just spoke, there's nothing that we have currently to prevent this other than social distancing, masking, and vaccination. When you come to the hospital and get admitted, you already have severe or critical illness. So it's really important to understand. So what we're then trying to do is to try to mitigate the inflammatory response as much as we can, and also decrease the other effects that happen with this virus. We know that one of the largest things that leads to critical illness and fatalities are the clots that often are associated with SARS-CoV-2. That being said, we should not be anticoagulating people on the outpatient side or with mild disease, because the risk of that is higher. The risk of bleeding is higher than the risk of preventing this type of thing. But if you come in the hospital, you will get anticoagulants as long as there's not a reason not to give it. The only truly efficacious drug that has been found is the use of Decadron now. Remdesivir does seem in certain populations shorten somewhat length of stay and maybe shorten some of the critical expression of this. Convalescent plasma, if it's given early and there's high antibody titers in the convalescent plasma, but we don't measure those, so we don't know specifically when we give it if they have it, those are also protocols that are used. What Caramon is doing is exactly what every other health system in the state and across the country does. We are continually scouring every piece of information that's available to us. We have continual dialogue with physician leaders when new therapies are coming forward to determine whether or not it is in the best interest of our community to use these, understanding that oftentimes when things hit the press, there's a lot of interest in them, and oftentimes they're pushed to the press by the manufacturer. But so we have to understand what are the downsides of those things. So those decisions about what protocols we institute in all the care for our hospitalized patients are following specific protocols. Those protocols have been developed by our physician leaders. A number of them who are on this call right now, they're part of the group that does that. And also our pharmacy leaders. Essentially, if you get treatment at Caramont, you're going to get the same type of treatment at Atrium, at Novant, at Mission, at Chapel Hill, at Wake. Like our community collaborates, we collaborate with all these other systems to share information that we're learning that may help our patients that we're managing.
Let me just add one thing here. I talk to physicians across the country. We're all working as hard as we can, particularly the physicians who are in the inpatient world. And I'm so impressed every day. But what I need everyone to understand is that there is no cure for COVID. There is no magic medicine that you can get inpatient or outpatient that is going to fix this. The best chance we have to keep people alive and safe and healthy is the vaccine. If we had a cure, please believe we would be pushing it out all day, every day. It would be on CNN and every hospital in the country would be clamoring for it. But unfortunately right now, there is no cure.
We've got just a handful of minutes left, and I want to thank everybody on the panel for their time and their insights today. I wanted to end with a question, and I'll kind of go around the room. Given how long of a journey and how difficult of a journey this has been, where are you right now mentally in terms of your fears, your hopes, and what do you see as, you know, the future going forward in terms of beating this disease? And I'll start with Steve.
Yeah, thank you for that. So where I am is I'm excited. You know, at any point in a pandemic, especially one of this global magnitude, getting to a vaccine that's as safe and effective as the ones that we have is the turning point. This is the point that we have all been waiting for. And I know a lot of us are still waiting for it. And again, your name is on a shot somewhere and it's coming, but I'm excited. I'm excited to see us through this thing. And like I said, we'll come out better at the end of the day for it on so many levels, and certainly as a community.
Major, also go to you, same question, kind of where are you mentally and you know, what are your hopes, you know, in fighting this going forward?
Well, we have to all get vaccinated, as everybody else has said, do that herd immunity. Mentally, not really wavering from any COVID exhaustion. You're here for the long haul to help everybody out.
Good deal. Thank you, sir. Dr. Reinhardt, I'll turn the same question over to you.
I'm encouraged. I think, just as Steve said, the vaccine has been huge. It really, the day that it came out was just a tremendous relief with our first EUA for that. I'm encouraged, but it's been a long haul. I see a lot of patients who are discouraged and are really tired, and I understand that, and we're all really tired of this thing. But the vaccine has been a very big ray of hope for all of us.
Dr. Harley, the same question to you, sir.
Sure, absolutely. I echo those sentiments that I'm both excited and encouraged. To Dr. Reinhardt's point, I've encountered a lot of patients and their families who have become increasingly discouraged. But in a situation like this, where there's still a few relative unknowns and people, let's just call it what it is, people are afraid. They're afraid of this, especially if their families have been affected by COVID, unfortunately, in a direct manner. So I think what's huge here is positive reinforcement from us, the medical community. And what I want to close with is just saying that for those who are afraid and you're just afraid of the unknown, you know, although the vaccines did not get FDA approval, they did get emergency use authorization approval, EUA approval. And so what that means is that although they're The long-term immunity data, which was touched on earlier, is not available. The efficacy data is complete, meaning that we do understand how well it works to prevent disease, and all of the safety data is complete. We have about 5 to 6 months of immunity data that continues to compound incrementally as each month passes. So with that in mind, if you understand that we as your medical professionals and healthcare providers are all in this with you together in real time, and we're all getting the vaccine as well, we will get through this together. That's my hope on this.
Awesome. Thank you, sir. Dr. Villarreal, I'll turn to you next.
That's a very good question. I am very, optimistic and hopeful that this is the answer that's going to help us get through it. But I think, as Americans, we need to realize this getting the vaccine is an incredible opportunity and privilege. And there's other countries that can only dream of the vaccine. So I think we should appreciate and realize how thankful we should be that we've been given this incredible opportunity as a country to show the world how we can get rid of this thing and how to deal with it. Because like I said, there's other countries out there that can only dream of ever getting this vaccine. So it's an incredible opportunity. And when I got the vaccine, I felt privileged and honored that I received it. So I think everybody should get the opportunity and should take it. And again, it's our only hope. I don't see any other way to deal with the pandemic other than the vaccine.
Excellent. I appreciate it, sir. Dr. Bowe.
I can say that I am hopeful at this point since we've gotten the vaccine. It's been a very hard year to be in healthcare, to watch our patients, our family members, our community members suffer. We've watched people die. We've watched people who are still dealing with COVID today. COVID is a terrible disease. It has really hurt a lot of people and a lot of families, and we're still helping people deal with that. And what's exciting now is we finally have a chance to fight back. I finally have a way to tell people how to protect themselves from COVID, how to stop this disease in its tracks. So while this year has been hard, I feel hopeful that other people are not going to go through what some of my patients and friends have been through. They're going to be protected, and we're going to be better off because of it.
Dr. Davis, the last word goes to you, sir.
Feel energized. As Dr. Bowe said, the suffering that we've seen has been extraordinary. And the challenges that our communities had from this have been immeasurable. When I received my vaccinations, is the first time I felt like I was actually able to fight back, which empowered me. Because to this point, everything I feel like we've done has been on our heels and has been retroactive. It's the first preventative thing that we've been able to manage. And the last bit of encouragement to the audience that's on the fence about whether or not they should get this, in our community, so with the physicians and the advanced care practitioners that are part of Caramont in their Caramont's community, over 95% have received the vaccine. So think about the physicians and the APPs in our community. These are some of the most skeptical people you will ever meet. They're trained to question everything. They are, physicians in general are some of the most risk-averse people there are. Over 95% of us are getting it. And if that doesn't convince people that we believe that this is actually safe and is necessary, I don't know what else can.
I think we've got some really great messages from everybody here today. I, again, want to thank everybody that's on the panel. This is just kind of the first in many efforts that the county will be making to continually engage with the community on education efforts about the vaccine. We want to continue to make these type of events available. We'll be doing some future Q&As with leaders in the community and providers. I know Dr. Bowe has been very active in doing some Q&As in some of the different areas of the community already. And so we want to encourage people to continue to ask your questions. If you have concerns, if there's things that you don't know about, this group and you know, whether it's the folks here from Caramont or County Public Health, you know, we want to be a resource to you to get you all the best information to be able to make that decision about the vaccine for when it's your turn to get your shot. Again, I want to thank everybody for watching today, for sending in your questions, and I want to wish everybody a great afternoon.